I'm happy to be joined today by Dr. Catherine O'Neill. She's the medical director here at Bucknell, and she's going to be answering some questions that we have about how to keep campus safe and the policies and procedures that we're using here at Bucknell for that purpose. So welcome, Dr. O'Neill.
Thank you. I'm really glad to be here, glad to be back on Bucknell's campus, as I'm sure you all are. And our goal is to keep you here and keep you healthy. So I really appreciate all the hard work you've done in developing this video.
Yeah, thank you very much. So one of the things that came up as I was working through this video and I was talking to some students about it is they had some questions about some of the aspects of the modeling that we're doing and the procedures that we're following here at Bucknell. And I'm hoping that you can shed some light on those issues. The first question that I had for you was to explain more about the differences between quarantining and isolating and just staying in your room, and what are the best practices that we can all do to help prevent spread here on campus.
So isolation is for ill folks. If you are ill, if you have COVID and you've been tested positive, you should go to isolation. You are alone, right? You don't have other folks around you. So somebody who goes into isolation will be going to our hotel off campus until they are cleared. And isolation is typically a 10-day process. It can be longer if your symptoms continue, because we want you to be symptom-free, including fever-free, for a minimum of 24 hours before you would return to campus. Quarantine is different in that quarantine, you are not ill, but you've been exposed to somebody who's ill. And because you've been exposed, we need to keep you away from other folks. It takes 2 to 14 days to actually develop a disease. That period of time is very key to keep people out of circulation. If you were exposed and then you go out and are around several other folks and then develop symptoms 2 days later, all those folks you were around have now been exposed and are now in quarantine and at a risk for infection. So quarantine and isolation are the biggest, most effective mitigation strategies that we have.
That's really interesting, and it's really important. It sounds like it's going to be very important for students to be aware of their own health and whether or not they're feeling well enough to attend class. It also sounds like everyone can do their part by maintaining the proper masking and social distance when they do visit with friends.
Right.
So one of the things that's been mentioned as an important way to control infection is not traveling off campus or outside of the Lewisburg area. But staff and faculty, many of them live outside of Lewisburg, and they're going to be coming on and off campus. So how are we preventing staff and faculty from bringing new cases into our community?
So my answer to that is we need to stick with all those mitigation factors, right? So staff and faculty need to be washing their hands frequently, wearing masks, staying socially distanced, doing their symptom check, and if they are having any symptoms at all, not going to class. Same as students, any symptoms at all, don't go to class.
And I think that that's a very important message to get out there, that if you're not sure, you should just stay home. And we have people that will help you either get your meals. You should be able to take any class online, at least for a short period of time, and see a recording or whatever the professor has worked out for that class for remote learners. One of the things that's come up is the idea that young people are not as much at risk as the elderly for this disease. And so some people have proposed that college students might not worry about getting COVID-19.
So there may be the perception that illness, it will not happen in this age group, but it certainly can happen in this age group. And the important piece that I hope everybody takes from all the information that they get is that it's your job to protect others,
Mhm.
right? It's not always all about you. And be thankful if you are healthy and you have none of those risk factors, but please take care of somebody who may be sitting in your classroom, walking by you in the hall or across the quad, who does have one of these issues.
And I've also heard that there are some long-term complications from some of these young people who have gotten infected, that they have heart or lung damage that might be lifelong.
Yes, yes. And I have actually had some contact with students who've been tested, not here at Bucknell, but had been tested and had no symptoms, but actually had some follow-up studies of their heart that showed some changes. So yes, I can say firsthand, I've seen that.
Do you think we'll be having to send students home at all?
I hope not, but of course, if there are students that are not complying with the um, mitigation policies, the social distancing, the mask wearing, and or gathering in large numbers, then that might be necessary, and we would do that if we needed to. So, Kendall, as a student coming back to campus this week, are you concerned about what's the environment's going to be like here at Bucknell?
I am concerned a little bit, and I was initially, but I think as long as students treat everyone around them, especially their professors, their other friends, as their own family, and keep everyone safe and realize the importance of keeping everyone safe because we care about our peers, especially since Bucknell is such a close-knit community, then I think we'll do fine. And I think as everyone remembers to the rules, staying socially distant, wearing mask wearing, then we can keep each other safe. And I think students definitely have an incentive to do so.
Yeah, that's very, very important. Thanks. Um, so Kendall, I know you're also involved with leadership here on campus. What do you think the role is of the different organizations here, sports teams and Greek organizations and other groups here to set the tone?
I think a lot of the leaders of all of these organizations have made it clear what we expect from students, and it sounds kind of scary, but I think students should just remember that we just want them to keep themselves and others safe. And usually our organizations involve being able to be connected to each other and spending a lot of time in person. But I think we should realize there's a new normal right now. And in order to keep everyone else in the Bucknell community safe, we have to act differently. And it's important that we're responsible and show people that we are deserving of the trust President Brodman has given us, and to make sure that we just be different, act differently, and to follow the rules so that everyone else on campus can come back and learn in person, because I know the in-person learning is important to what we do here. So anything we can do to support that is important.
That's really great to hear. Now, the organizations that you're involved with, how have they changed what this fall is going to look like compared to a previous semester?
We've eliminated a lot of large in-person gatherings that we would usually have. Even smaller in-person gatherings, we decided to eliminate and to change to over Zoom just to protect everyone in our communities, and finding other ways to connect that are not necessarily in person is important. And I think if we continue to do that, hopefully we'll see low case numbers and a lessening of restrictions. And also as President Brodman did, we've set a clear tone for what would happen if students in those organizations didn't follow the rules, but hopefully we won't have to come to that.
Yeah, I agree. I think that the modeling shows pretty clearly that we could get through the entire semester without any severe lockdowns or anything like that, but it's going to require everyone to cooperate. And I think, you put it very nicely. We're all a family here, and we all need to protect each other as though we're family. I think that that's really important.